Okay, so welcome everyone to the latest in the series of Humanities versus Pandemics, our seminar series where we are presenting lots of different perspectives on the COVID-19 pandemic. In fact, we have so many speakers that we are now planning to extend the seminar series into next semester. So keep an eye out for further announcements on that. I am very happy today to introduce Professor Schenk, who is going to talk to us about what do people in Kazakhstan believe about COVID-19. So thank you to our speaker, and please go ahead.
Okay, thank you much for participating in this session. So what I'm going to present today is very, very preliminary work that me and a group of research assistants are doing on a number of different aspects of the pandemic in Kazakhstan as well as in wider Eurasia. So we're comparing also with Russia and Kyrgyzstan, but for now we're focusing on Kazakhstan, and to some extent we're looking at Russia as well. So yes, I've entitled this this talk "Fact or Fiction: What do people in Kazakhstan believe about COVID-19?" And I will say that that is a very provocative title, and I did not intend on being very provocative. So in some ways, well, I'll explain a little bit more about the title in a minute. But first, I wanted to just kind of give you a little overview of the project that we are looking at. So I have a grant from Nazarbayev University. And the grant project is for about 2.5 years, so it runs through the end of 2022, and it's called Crisis, Risk, and Uncertainty in Modern Eurasian Governance, Managing the Politics of Fear and the Politics of Science in the Era of COVID-19. And we're looking at 3 kind of broad categories of, phenomenon related to the COVID crisis. First, we're looking at what people believe. And we're doing this through interviews, we're doing it through surveys. We're using, I should say that our project is extremely methodologically eclectic. And so we're drawing on a number of different strategies to really try and triangulate what's actually going on in the region, and at the micro level as well as at the government level. So we're looking at what people believe by talking to them one-on-one through in-depth interviews. We're also going to scale that up to nationally representative surveys. We'll also probably do some survey experiments and some internet surveys and that sort of thing, maybe a little bit later. We're also looking at how people act or how people behave by observing them in their kind of natural environment, which is just kind of out in public. So we have a structured participant observation methodology that we're using that I'll tell you a little bit more about today in this presentation. And we're also crucially looking at what governments do through policy analysis and through the analysis of media. Now, media, it doesn't always tell us exactly what governments do or how governments think, but in this region, since most media is state-owned and state-run, we can use that to kind of give us some insight into how the government is messaging the public and in what ways they find effective to message the public about issues like COVID. And then we're looking at what actual concrete policy decisions are being made as well and how they're being enforced. So I have a really huge team that actually makes this project really fun. And I think, I can't say enough about how great this team of mostly students is. So the students from SSH, we have a student from medical school, from NUSOM, and we have students at the bachelor's level, at the master's level, and at the PhD level, all coming together to do this really sort of cacophony of data collection, which is sort of wild, but also really energizing and fun. We also have in some of these teams students contributing through some of my classes. So they're kind of doing some, maybe some extra credit by kind of collecting little bits of data here and there, or, kind of focusing certain aspects of class assignments on data collection. So the team is really actually a lot bigger than this. And so but I don't actually have space on this slide to name everybody that's involved. But nevertheless, this is, there's two great aspects about this team. And one is that I learn a lot from the students and from their perspective. So I've really been thankful for all of the input that they've given me. So, certainly they're doing data collection, but we have time to just reflect and discuss what we're seeing and what we're finding. And that has been really useful and really enlightening. But I think that also these different data collection aspects are really pedagogically useful. So hopefully the students are learning alongside me about different ways of collecting data that they can then use in their own projects. So I think this has been a really great opportunity, I hope, for all of us. Okay, so when you saw the title, Fact or Fiction, what people in Kazakhstan believe about COVID-19, you may have thought that I was going to separate fact from fake news and assign people to categories of those people who believe in the truth and those people who believe in lies. But that is not what I'm going to do. In fact, I think that type of rhetoric is actually really dangerous and really polarizing, and even can be dehumanizing, because at the very least it implies that if you don't believe in the orthodoxy or the facts about coronavirus, or if you question the orthodoxy, then somehow you're anti-science or a conspiracy theorist or an anti-vaxxer, or whatever other invectives are placed on the other category of those that don't believe in the truth. And I'm really not interested at all in furthering this type of us versus them discourse. Rather, I'm interested in understanding what people believe and why they believe that. And in order to do that, I'm taking a bottom-up approach when it comes to data collection. So exploring what people believe and trying to not too quickly filter it into boxes or explanations, according to certain theoretical frameworks. And then I want to disentangle these findings from dominant theoretical frameworks and discourses. So I'm taking a very grounded theory approach where I'm exploring theory, lots of different types of theory, at the same time as we're collecting and analyzing our data. But I do want to just share a couple of thoughts on the theoretical level before I turn to our preliminary data. And the first is that we need to certainly differentiate between truth and hegemonic discourses, or those sorts of ideas that are taken as truth and repeated as truth, but may in fact be entangled with a lot of conjecture. Second, when we're thinking of scientific ways of knowing, we need to understand that scientific ways of knowing, and here I'm calling these positivist epistemologies, that these are not the only ways of producing knowledge. And in the social sciences, there's a very serious debate about whether positivism actually helps us understand underlying social processes. So this study doesn't take positivism as a given in social analysis, but rather it explores a variety of paradigms, including more interpretivist, Foucauldian, but not only Foucauldian frameworks, and also takes seriously the issues of power, not only within states, which would be more like a biopolitical understanding, but how dominant and often Western theories can drown out locally produced knowledge and understandings. So my approach takes seriously the difference between belief or faith and knowledge, applying that both to scientific belief systems and to those types of beliefs that we usually deem as non-scientific. So it also takes seriously the idea that what we don't know is every bit as important as what we do know. And but that in the context of uncertainty, actors act without full knowledge. And this is a perennial problem in political science. And this, I think, is actually what makes the current COVID crisis, COVID pandemic, so political. So ultimately, as a political scientist, I see every question as one that's political. For me, politics is everywhere. It's in how information is distributed. It's in how people decide whether to wear a face mask or to follow social distancing guidelines. It's in whether people choose to believe the government's messages or in the WhatsApp message that their aunt sent them. These are all deeply political questions. And the role of belief or knowledge production and uncertainty are crucial in the sort of battle over ideas that come to frame and justify the ways in which governments and individuals act. So that's all I'm going to say about the theoretical frameworks, and they're pretty underdeveloped at this point. They're very exploratory, and I really haven't settled on exactly how I'm going to frame the results of this study. And I think that's actually really important, not to settle on something before we figure out what's kind of going on the ground. But I do want to tell you a little bit about what we have found so far. So please keep in mind that this data is very, very preliminary. We certainly can't generalize to the population or to certain age cohorts or even to the categories of people that we are interviewing. But I'm going to share a little bit about what we found so far from our interview data and from our participant observation data. So first I want to talk a little bit about our interviews. So we have a team of 7 interviewers, which are me and 6 graduate students who are conducting interviews in Russian and English and Kazakh. So far we've collected over 100 interviews in Astana, Almaty, Taras, Kokshetau, Shymkent, Karaganda, Kostanay, Taldy-Kurgan, Pavlodar, Atarausk, and a couple of interviews with Kazakhstanis who are currently abroad. So this is actually the great thing about conducting ethnography in the pandemic era, right? Because everybody's on Zoom and students are in their hometowns. And so we can really leverage not only the virtual aspect that everybody's basically doing everything on Zoom. And so this kind of reduces the bar for kind of getting in contact with people, personally, right? Because we know that we can reach out to them by Zoom. And then the fact that students are all over Kazakhstan also really helps to kind of, tap into some of their networks. So in interviews, we're looking at, we've talked to business owners, medical professionals, medical experts, school administrators and teachers, and just a lot of regular people that have all sorts of different types of jobs. And we're asking them a range of questions, including what sources of information they trust, if they work in an organization, and especially if they're in a decision-making role, how do they get their information? We're asking them about their orientation towards the virus itself, towards various types of treatments, and towards vaccines. This is a big kind of subpart of our analysis and our investigation. And of course, we're asking them, since I'm a political scientist, about how they feel about government policies and whether they trust not only the information, but the policies that the government is making. So just, again, some very preliminary observations that we have in each of these categories. First, about information flow. So some groups have privileged access to information, but it's maybe not the groups that you might expect. So, we've interviewed some people in the ministries, and they don't necessarily have access to information about policies or, kind of new procedures dramatically earlier than the general public. But they may have information slightly earlier than it is posted online or something like this. Often, even when information is given ahead of time, it's a matter of just hours earlier, not necessarily days earlier. But you may have noticed for yourselves, and I have certainly noticed, which has driven me to ask these questions, that sometimes information will come through networks before it actually comes through official channels. And I think that is one of the really interesting aspects about the information flow in Kazakhstan that we're still don't have a really good sense of, but that we're trying to get a handle on. Where is this information originally coming from, and how do people get access to it first? Rather than through their networks. I mean, I tried so hard back in March and April to be the first in my network to get information from official sources, but those official sources were not the first places that information was being handed out. And so that's one of the, kind of, we're looking at these networks of how information is distributed as I think, a really important aspect of how the government communicates to people. Information flow within organizations is pretty interesting. It's often very hierarchical. So both in hospitals and in shopping complexes, information comes to the top level first and then kind of trickles down. So information actually really varies in terms of organizational culture and probably organizational transparency. So those people that are at the bottom, how quickly and how fully they get their information probably has a lot to do with the type of organization that they're a part of. But employees and business owners in malls, like shopping centers, are actually quite dependent on the administration in those organizations. You know, information gets trickled down, whereas business owners who are in independent kind of spaces they aren't necessarily as dependent on those administrative structures for their information, but maybe they don't have as privileged of access to information as well. Doctors are likewise dependent on hospital administration and the rules and protocols that come from the Ministry of Health. And these are, again, are very hierarchical, and there's not necessarily room for kind of flexibility on the ground. It's more about, you know, hierarchy and implementation. Where do people get their information? Well, a lot of people, you'll not be surprised, get their information from social media. And I'm sure that this is not at all unique to Kazakhstan. Many people get their information from, I guess, both formal and informal types of social media. So, you know, things like Instagram and Facebook and Telegram certainly have access to official news sources. And so sometimes people are getting official news through these social media outlets. But this also includes informal types of groups and organizations. So the WhatsApp chats of your business or your group, you know, your employment group or your fellow employees. There's also arose WhatsApp chats organized around people who had become ill with the virus, or WhatsApp chats or Telegram channels for you know, organized by doctors giving medical advice to people as they were experiencing symptoms. Other times, you know, people are following key medical figures or social figures on Instagram and Telegram, and these are, you know, these become information channels for you know, kind of fact, but also not fact, right? Some conspiracy theories come through these channels. Certainly there's official sources that also that people seek out in order to get their information. And it seems like in the early days, people were really glued to the media. I know I was. So, you know, really seeking out information from as many sources as we possibly could. So kind of going to the internet, looking at official news sites in order to get information. There was a survey done by Общественное мнение, the public opinion group in Astana, public opinion sociological research firm. They did a survey in early April and found that about 46% of people were watching TV and getting their news from TV, and about 33% were going to the internet for their kind of first, you know, the initial, or, you know, most frequently going to those sources for information. And we tend to see that, I think we're seeing that still, that people are getting a lot of their news from TV, and also looking at key internet sites in addition to social media. I would imagine that there's probably an age breakdown or an age kind of factor in which sources people are getting their information from. But we don't know that. We just know kind of what questions we want to ask about that. We don't necessarily have any data on that. In terms of what people believe about official data and what people believe about the virus and vaccines, there's really a range of beliefs in Kazakhstan. So there's a lot of diversity, and so and I think that's important. There's a lot of diversity and a lot of nuance in what people are believing. So when it comes to official data, for the most part, the people that we've interviewed do not believe in the official statistics in terms of the rates of infection and rates of death and things like that. But it's also interesting that people don't really seem too concerned about that, and in fact are a little bit dismissive that, yeah, okay, fine, the information is not, it's not real, it's not true, but you know, what are you going to do about it, right? So it doesn't seem like something people are really debating heavily. And about the virus and vaccines, there's, you know, a lot of beliefs also. And it seems that having a medical worker in the family tends to matter for how people, what people believe about the virus. So people that have a relative who's a medical worker tend to look to those medical workers as a source of information rather than to the media, or maybe more than they look to the media. However, both medical workers and the general population typically know someone who has had the virus or had the virus themselves. And the attitude on the whole, in fact, is pretty nonchalant. And though there was significant fear back in March and April, and I mean, if you can remember yourselves back to those days, you know, kind of what you observed in those times. I just remember getting into the elevator and, you know, people would turn their backs on, like if I didn't have a mask or if somebody else didn't have a mask, they would turn their backs so that they weren't facing the people in the elevator. I think there were, and the data from the public opinion survey also shows that there was really high levels of concern among the population in April. And I think in many ways that fear has really waned in some ways, in certain ways. And I mean, we don't have data on this. This is something that we need to measure, but I'm sure that those levels of fear are kind of, they're varying over time. Nevertheless, there are still groups of people who are very frustrated with others around them for not following social distancing and regulations. And on the other hand, there's certainly people that don't believe that the virus is real. So you really do have a range of beliefs on this in Kazakhstan. And there are also some people that we've talked to that are really quite traumatized by their experiences. So whether it was the psychological stress of quarantine or the illness with the virus themselves, or for the doctors, the stress of treating sick patients, this trauma is really not, that doesn't wane so quickly as maybe the fear factor does. And that's actually something that's pretty interesting. It's really hard though to get at sometimes in interviews, because, you know, these are people that have been traumatized and they need to be, you know, treated carefully in terms of interview methodology. Sorry, we have a really aggressive cat. I'm going to give her to you. You can put her out. On the issue of vaccines, some people are for vaccines and some people are against vaccines. Some people are skeptical about the vaccine depending on where it's produced. So meaning, like, if it doesn't come from China or Russia, then maybe it's better. Others, and many, are really taking a wait and see approach. So they definitely don't want to be the first to receive a vaccine. And they'll just kind of wait and see what the other people around them do. Many people who have been sick already, even doctors, say that they've already been sick with the virus, so they don't need the vaccine. And so this is something that we're seeing consistently over and over. In terms of practices, individual practices and institutional practices, on the individual level, you know, as you probably know, and we're confirming through our data as well, many people continue to go to wedding celebrations, to funerals. And some people have cited social pressure as the driving force, right? It's expected of us to go to these celebrations or these commemorations. But it also seems that people are pretty well aware that these are high-risk zones for spreading virus. And many people, in fact, have stories of their friends and family who became sick after attending these events. And certainly, and then in terms of institutional practices, I think different institutions have different particularities. So hospitals, like I said before, are definitely more hierarchical, and they're also under a lot more scrutiny from the Ministry of Health. And so this creates some interesting kind of institutional dynamics in terms of what people do, or what doctors do, and why they do the things that they do, and then how they talk about that. For schools as institutions, we don't really have a lot of data yet. That's something that we're going to look at a little bit more in the future. It seems though that businesses vary the most, and they vary by region and they vary by a number of different other factors as well. So it seems that different akimats have different kind of policies and procedures for regulating businesses. It seems like certainly there's a lot of informal practices when it comes to businesses. So I guess it depends on how comfortable business owners are with pursuing informal channels that maybe kind of go outside of government regulations. A number of other factors that businesses certainly that vary from business to business. Oh, the other thing I wanted to say was businesses do tend to diversify. So a number of businesses have diversified to kind of try to adapt to products and services that are more kind of pandemic and quarantine friendly, right? So businesses actually have been pretty flexible during the quarantine, which is not at all to minimize the problems that they've encountered, but to say that there's been some creativity in that sector as well. To answer the question of whether people trust the government, well, like I said before, nobody really trusts the numbers that are coming out of the government. And this is actually kind of, in some ways, not particular to Kazakhstan either. Some of it has to do with government trust, but also it has to do with just methodologies and changing methodologies, and whether people accept the types of methodologies that governments are using to produce numbers, and all of those things are important factors. When it comes to people's trust in the government for their policy decisions, this also ranges. So some people are frustrated with the government for being too restrictive. Some are frustrated with the government for not being restrictive enough. And some people blame the government as the source of the virus. And this, in fact, brings us to the phenomenon that I want to talk a little bit about of conspiracy theories, which are visible everywhere, but certainly have some nuance in Kazakhstan. So I just want to say thank you to Ali Muhambiet, who has done a lot of research for our project on conspiracy theories and has really dug into what some of the conspiracy theories are in Kazakhstan. So here, as everywhere, you'll see kind of adherence to some of these global conspiracy theories that, Bill Gates is in charge. I guess he's the new George Soros, right? Because he's the one that's trying to take over the world. And, like 10, 15, 20 years ago, it was George Soros. But Bill Gates, he's the leader of all conspiracies these days, and the Masons. That's what my taxi driver told me the other day. That there's conspiracies related to 5G and putting chips in people through vaccination, and these are conspiracy theories that are certainly not confined to Kazakhstan. But there's also sort of local conspiracy theories that some things like the government is spreading coronavirus, that's distributing the virus through kind of dumping it on people by helicopters, either the virus or other poisonous substances. And when we hear this type of information, it's really important to really think about what really is a conspiracy theory, and why people believe in these types of rumors. So really what we have so far is just a couple of tentative hypotheses that we're going to look at a little bit more. So one of the hypotheses is that people with low trust in government may actually be more likely to believe in these conspiracy theories. So, right, so if you don't like the government to begin with, if you don't trust the government to begin with, then you're probably more likely to believe that the government is actually behind spreading the coronavirus. Another hypothesis that we might look at is when people with low trust in government encounter the effects of coronavirus, things like the death of family members, they might be more likely to accuse the government, again, of sinister motivations. So again, these are things that are very tentative, but that we are kind of looking into. And we're also looking at how resonant these ideas are in the case of Kazakhstan. I want to come to our participant observation as kind of the last bit of data that we've collected so far. And the idea behind our participant observation is to observe whether people practice social distancing and wear masks as prescribed by law, and if these laws are actually enforced either by police or by business owners or by private security guards. So what we're doing is we're sending students and myself into the field to just kind of watch people, right? So this is kind of scientific people watching. We have a structured tool that standardizes our observations. So we use a Qualtrics survey to, basically research assistants, they go into the field, they kind of count up, they know what the Qualtrics survey is going to ask them, but they go in and they count up different categories of people wearing their masks in different ways, and they kind of observe, all of the different types of phenomenon connected with COVID regulations. And then they go to our survey instrument and they input their information. And we developed this survey instrument using kind of by going out into the field ourselves. The ethnography team kind of went out in the field and kind of started observations, and then we figured out a way to kind of systematize this. And then we brought in other students from other classes and volunteers. And again, the value is that the students are all over Kazakhstan. So you can see in the bottom left-hand corner that we have observations so far in 3 cities, and we expect to get more, and we'd like wider coverage. We'd like more of a broad coverage around the country. We're also trying to repeat observations in the same places at the same time, again, to try to kind of get a more replicable type of data. So far we have 116 observations. More than half of those are indoors, so places like supermarkets and buses and bus stations and shopping malls and cafes and things like this. And some interesting observations. So right here, then this is just kind of a smattering of our data. But you'll see that actually quite a lot of people are practicing social distancing. So if you see this bar right here, about 42% of people are practicing social distancing, meaning that they're kind of far away in groups. You'll also see that it's that our observers are three times more likely to meet a group of 2 or 3 rather than 5 or more. So this does indicate that people are kind of going out in maybe smaller groups than larger groups, according to what we've observed so far. However, you'll also see that people are 3 times more likely to see a person that has no mask rather than somebody that is fully covered. And this doesn't even take into account the people that are not wearing their masks correctly, which we all see, of course, around town. But we're just trying to systematize these observations by putting them through our Qualtrics survey. As far as employees and business owners, you'll see that a majority of them, in fact, do wear their masks correctly. And that's, I think, because we see the enforcement of regulations has disproportionately been on businesses. So you'll hear about kind of raids and things like that on businesses, whereas we hardly ever see kind of on the spot, police warnings or fines given to individual people. So that shows up in our data. But of course, if you walk around town, you'll also see that that's hardly ever the case. You'll see police all over town, but they very, very rarely, if ever, remind anybody to put their mask on or give people any sort of sanction for not wearing their mask. Okay, so this is what we know so far. We're going to use these findings to shape our further investigations, and we're actively working on some media analysis that I'm not going to talk about because it's really exciting and super secret because it's really innovative and awesome. So I don't want to tip my hand by telling people too quickly. But we're really developing our instruments for gathering other types of data using these preliminary data that we've already found. We're soon going to put some survey questions on omnibus surveys in Russia and in Kazakhstan. So that's something that we're developing right now. We have a group of students. We actually have quite a lot of students working on the CoronaNet project, which is an international project. I'm one of the PIs on that project, and there's 7 other PIs from US, Europe, and about 400 data collectors. And so we have from NU about 30 or 40 data collectors or students that are participating in data collection. And this is a really great opportunity and a great project that is looking specifically at government policies and government responses to the coronavirus. So all the data is publicly available, and it's you can see it during that in that link. I also wanted to, again, advertise the survey that Public Opinion did in early April. You can find it at that link, and that's the data that I referred to in the presentation. So that's what we know so far. Again, it's very preliminary, not really generalizable at all, but it gives us a lot of food for thought and some kind of things to investigate further as we go on in our project. So thank you.
Thank you. I'm gonna clap virtually. Okay, so thank you to our speaker. To our audience, we now have some time for questions. I'm going to ask you, if you have a question, you should find a button. I think it's in the chat function. There should be a button where you can raise your hand. So if you'd like to ask a question, please raise your hand. I'll call on you and you can unmute yourself, because there's far too many of us to do it otherwise. Whilst people are considering their questions, I'm going to use my prerogative as host of this Zoom meeting to ask my own question. So what I was interested in here, looking at the questions you're asking, so we've had various things on the origin of COVID-19 and various things on how we're dealing with COVID-19. One of the issues that I've seen in terms of what people are thinking about it has to do with the nature of the virus itself. So there's this popular idea that if you get it, either you get the flu for a week or you die. Whereas as we get further into the pandemic, we get a much broader range of things, and we've seen long-term neurological problems and this long COVID of fever over a really long time period. So are you also looking into this issue of varying ideas about if you believe in the virus, what do you believe about the virus?
Yeah, that's a great question. And I guess we hadn't really, so far we really didn't, I guess we don't really have a nuanced sort of way of asking about that. But I guess it's worth thinking about, because I think, I mean, in some ways, the beauty of kind of open-ended and semi-structured interviews is that some of that comes out anyways, right? You get some of that, different people's experiences. But according to what we've heard so far, we don't see a lot of nuance in terms of different people experiencing different things. And that's actually pretty interesting in terms of what we're not finding, because it doesn't really match up with what we read in the Western news about all of these different varying consequences of the virus in the short term and the long term. So yeah, I think that is, that's something I'm going to make a note of and kind of think about for how we can better integrate that into our inquiry.
Okay, thank you. Funda, I can see you have your hand up.
Hi, thank you very much for your presentation. I have a technical question about the data collection methodology. I also have a grant and I have to release my surveys soon. They are ready, but I'm kind of hesitant. I would appreciate your answer very much. Are you the main source of all collected data? How do you use your small teams?
I'm not sure that I understand the question.
So all data comes to you, or all groups have their own data and they share data with you?
Oh yeah, we all share our data together. So, well, I mean, that's actually not true. So depending on the type of data collection, so if obviously we anonymize our interviews before we share them with anybody outside of just the person that's doing the interview and me. So we do, so we have an interview team, and we have shared some of the interview results among the team, but for the most part, it's just those interview transcripts. And I actually don't even, they're anonymized before they come to me again. And I think that's a good, good kind of protective layer. So all I get is the transcripts in some cases that are fully anonymized already. And those are just between, again, the interviewer and myself. So again, it depends on the type of data. The participant observation data, I mean, we don't share it among all of us, though that's just kind of a technical issue, not necessarily a privacy issue, because all of that data is anonymized anyways. We never collect any sort of identifying data when it comes to our participant observations. For the surveys, we're contracting that out. So that will come to me just as, again, anonymized survey results. And we're going to use firms like Levada Center in Russia and NAC Analytica here in Kazakhstan and the like in Kyrgyzstan. So, I mean, in some ways, I try to share as broadly as possible all of the steps with my whole research team, again, because this has pedagogical value, and only those things that have issues of kind of needing to be de-identified are things that we don't share with the whole entire team.
Thank you.
Mm-hmm.
Do we have further questions? Would anyone else like to raise their hand and ask a question? Oh, Nurlan. Do you have a question for us?
Yes, good afternoon. Thank you for your presentation. I have a question. You said that one of the theories of why people believe all these rumors is that people don't believe the state. So my question is, what should the state do to improve people's trust in the government during the pandemic?
Yeah, that's a great question. I remember thinking back, in the summer, and it was before these conspiracy theories came out. The conspiracy theory about the government spreading coronavirus by helicopter. This was put out by like a social media figure, right? Like one of the kind of the influencers in Kazakhstan. And before that came out, I was thinking, well, if the government would only get like social media figures on their side to kind of do, whether it's like, hand washing campaigns or just like public awareness sorts of things in a way that makes it actually seem cool to wash your hands or cool to wear a mask, right? That actually would have been a really good idea, but they didn't do it, unfortunately. And I think that the mistrust between between state and society is something that's really long-standing, and it doesn't have an easy remedy. But that's actually one of the things that we really, really want to try to understand at a deeper level in this project. So I don't really have a lot of recommendations for the government. But it's something that I do want to understand a lot better before I would, before we can, I think, understand how to make it, how to improve the situation.
Okay.
I have a note from Jean-Marie. I hope I'm pronouncing that correctly, yes. In the chat. Would you like to ask a question?
Yes, I put on the video, so I don't know if I'm video. So I have a question. When I spoke to Kazakh people, I think in June or May, many of them expressed the opinion that that the coronavirus is actually a stealing scheme. So that the government gives money to hospitals and maybe to local governments to support people who need help for the coronavirus, and that most of this money gets stolen. So did you ask the people, and did you try to measure this? How many people believe this? Because my impression was that many Kazakh people believe this.
Yeah, that's a good question. It's a good question. It's one that we're really keen to, that we're really, kind of keen to understand. Yeah, we hear that all of the time. How to measure that in a survey, I think at the large scale, it would be a little bit tricky. But nevertheless, probably the best way to look at that question on a large scale would be through kind of survey experiments. And those are instruments that we haven't really developed yet, but we want to probably in the last year of the project, because I think that those are important ideas, and especially when you have states that have large degrees of corruption. Anyways, the idea that the governments are using budget allocations to further their own.
If it really happened,
yeah,
but
yeah. I mean, how not only it's not only a question of belief, but it's also a question of like actual fact too. Yeah, we definitely have our eyes open to those sorts of developments.
And maybe can I ask another question? So, do you think that Kazakhstan reacted very aggressively, very early? And maybe because of this, people didn't believe in it. Would it have been, maybe you cannot decide this, but would it have been better if they would have waited longer so that people will see the consequences before the actions from the government?
Oh gosh, that's I guess it's kind of not typically the way that we think about it, but I don't know. I mean, yeah, I mean, I remember, personally feeling like the government was kind of blowing things out of proportion. Because I had a trip I wanted to go on and I didn't get to go on because I thought that the government, I mean, I was supposed to go to Sweden, and of course the Swedish government is a lot less restrictive. And so I'm thinking, well, if Sweden's letting me go, why is Kazakhstan not letting me? So it did feel like they were early, but if we look actually at the data of when governments were making decisions to kind of close borders and lock things down, Kazakhstan was about on par with a lot of other governments. So, could they wait, so that people could take things seriously? I mean, there's a moral hazard, right, to that sort of approach that, maybe they could have, and maybe people would have, but I'm not sure that it actually, would it be really effective and would it be ethical? I think are probably two big questions that would be important to ask in response to that.
Okay, thank you.
Thanks.
I'm just going to jump in on the end of that question and say there is a strong feeling amongst the epidemiologists that all effective pandemic responses look like overreactions. Because if it's under control, it looks like there is nothing to control. Sure. So this is a big issue for not just Kazakhstan.
Declared state of emergency, I think, when there were only maybe 10 cases in Kazakhstan, while at the same time Germany waited, I think, until there were thousands of cases.
Yeah, but Germany has a much more robust healthcare system than us. Mm-hmm. So.
Yeah, no, I think I remember thinking again back to the beginning that it did feel like Kazakhstan was making a very securitized sort of response, but at the same time, that is where their state capacity is, right? State capacity is in police. State capacity is in kind of these authoritative decision, these authoritative moves, right? State capacity is not in the healthcare system. And so in some ways it seemed harsh, but it seemed kind of fitting, I guess, because they were using the state capacity that they had to do what they could. It still didn't work, right? Because for all sorts of different reasons. I mean, or did it work or did it not work? I mean, that's conjecture, but we still see really large virus spikes, and is that because they let things go too early, or all of those questions that everybody is asking, and we don't have any magic bullet answer. We don't have enough data to really make any conclusions on that yet.
Okay, I have Basit has raised their hand.
Hello. Thank you, Professor Schenk, for your presentation. My question is about dissenting international experts and how it affected the opinion of local people. So, for example, recently, there has been a Great Barrington Declaration, and 9,000 epidemiologists signed it about the severity and the lockdowns. So how do you think these dissenting experts, especially from the start of the pandemic, affected the opinion of local people? Thank you.
Oh yeah, that's a good question, right? And that so far that hasn't really come up necessarily. I mean, because the kind of I'm trying to think the best way to approach that question. It seems like the major dissenters in terms of, well, maybe let me just say this, like the things that are getting through are kind of the big time conspiracy theories, right? that the declaration that you're talking about, I haven't seen, again, I haven't seen any evidence that people have really attached themselves to that. I'm not sure why. Maybe that's something worth specifically asking about some of these specific kinds of developments. Because I think what you kind of what you're getting at is a sort of international diffusion of ideas. And I think it is interesting to know which of those ideas are coming through and which of them aren't, right? Because some of them clearly are coming, some ideas are clearly coming through and some ideas clearly aren't coming through. And why is that the case? So, I mean, I think one of the, not exactly what you asked, but one of the things that we're looking at is sort of people that are vaccine hesitant or anti-vax or whatever you want to call them. And where those ideas are coming from. Are they coming from Russia? Are they coming, is it a global diffusion? Like, are they coming from, you know, groups in the West, or are they more kind of, do they have local origins and local concerns? And that is definitely something that we're looking at, but kind of looking at some of these bigger kind of dissenting opinions is probably something we need to more specifically integrate into our inquiry. So yeah, thanks for that. I appreciate that.
Okay, further questions?
Hi, Caress, could I ask a question?
Yeah, of course.
I was wondering if in your research, you've looked at people's beliefs about coronavirus and children. Because this is one of the things where in lots of places, there's been a wide range of opinions from people saying children are totally immune and can't get it, or children might not get infected, but they can spread it to other people, and lots of other things around that too. Is that one of the things that's come up in the data that you've collected so far? Do you get a sense of, you know, is there a range of opinions here as well as to like how vulnerable children are, whether they might be super spreaders of the virus, anything of that sort?
From what we've seen so far, there doesn't seem to be a lot of concern about kids. So why that is the case, I think might actually be an interesting question. And one of the things actually one of the ways that we could probably get at that is not only talking to just regular people, but looking at, you know, talking to school administrators and seeing kind of what sort of evidence, if any, they're kind of basing some of their claims on. But that has not come out as a major theme when we're asking people about, you know, so even people that have children and we're asking them, we're asking them about kind of regular childhood vaccination just to kind of get a bellwether for how they might how they might orient themselves towards a coronavirus vaccine. But still, kids seem to be just kind of like, oh, well, they're, yeah, they don't get it and they aren't affected. And that tends to be as far as it goes, according to what we've seen so far.
And do you have data on this from your kind of on the street observations too, about like the proportion of children wearing masks versus adults, or?
We are collecting some of that. And I mean, of course, the rules are that kids under 5 don't have to wear a mask. And so sometimes when we see kids under 5 wearing masks, well, that's really interesting, right? And so we do have some data on children and masking and a little bit, but I would need to dig into the data a little bit deeper to actually answer that question. But we do have some data on that.
So I can see Maria has raised her hand.
Yeah, thank you. I just wanted to ask, I don't know if this if this question can have an answer, but do you think this spread of conspiracy theories right now will lead to some sort of political, societal consequences? Because like in the Middle Ages, after the Black Death epidemic, there started, the program started and other things, and here it just I'm quite astonished how many anti-Semitic theories I hear every day about rich Jews trying to kill the rest of humanity with COVID. And I'm just wondering, can it have any sort of consequences later?
Yeah, that's a good question. I think, well, I mean, on the one hand, I want to say that, there's so much conspiracy theory that's kind of just habituated in society. So I have a colleague that is just putting out a book on conspiracy theory in the Eurasian region, and just, demonstrating how conspiracy theory has been part of the fabric of belief systems for a long time. But obviously things are different and more intense in periods like this, right? But I think, I guess it depends on, whether that change will be subtle or whether it will be kind of disruptive. And I don't know. I mean, maybe that's a question that we can't really answer right now, but should be aware of how things are looking going forward. I don't, at least in Kazakhstan, I get the feeling that it's kind of just a run-of-the-mill sort of conspiracy theory, right? It doesn't have it doesn't have the salience of something that is kind of world-changing. As world-changing as the events obviously are, I think a lot of times people are just kind of taking it as, well, okay, we're in a pandemic, okay, let's move on, right? Sort of stuff. And same with both on the conspiracy side and on the non-conspiracy side. So again, I think that question it's really hard to answer, but I think I would think that it would probably have more of an effect maybe in the West than in areas like this.
Because in the West, I just have not seen the same reaction. But here, basically, you can, whenever you meet a new person, you can ask them, "What do you think of COVID?" And 9 times out of 10, they'll tell you it's who is behind it. So
right,
just wondering.
Yeah, I'm not sure how much that has actually changed though. Like, so if you would have asked them about, something else, right? 2 years ago, they still would have given you these, you still might have heard the similar sorts of, conspiracies, George Soros and all of these sorts of things before this. So, I mean, in some ways it's kind of, same song, 12th verse or something like that. Thanks.
Further questions? Akshol?
Okay, thank you. I have a question on your point on this privileged access to information. As far as I noticed, it is about the difference between people who work in governmental, kind of authoritative positions, but are you planning to consider the specificities of kind of people of different language groups, as people who speak only Kazakh, Russian, or maybe bilingual?
Right.
And also the geographical positions, not in terms of like Astana, Almaty, and other cities, but the people who are living in rural areas and in like the city centers and so maybe districts and so on. Thank you.
That's actually a great point. I'm just making some notes so that I don't forget your points. Because I'm sure that you're right that there is a really huge difference in access to information in terms of, I mean, I guess if you're in the rural areas, all you really have access to is television news. So, we can look at some of that, when we do our nationally representative surveys to see if there's kind of differential access to a variety of news sources. But yeah, so far we've been just kind of looking at who has kind of insider network access, and it's not only government officials, it's also kind of people, the people that are invited to those kind of closed press conferences, right? And that might be yeah, and maybe it varies from ministry to ministry, because like Ministry of Education might give out information in a different way and a different speed than Ministry of Healthcare. So, but you're right. I think adding those questions about urban-rural divides and it'll be really important. So yeah, I've made a note of that to make sure that we do include that in our analysis. Thank you.
Okay, other questions? Whilst I'm waiting to see if anyone else raises their hand, I just wanted to raise another point that occurred to me from both Maria and Jean-Marie's questions. So Maria raised this issue of the long history of anti-Semitic accusations and how they've been folded into COVID-19, and Jean-Marie mentioned COVID-19 accusations that intersect with issues of corruption. So both of those are things that were already existing in society and what people talked about that have been linked into COVID-19. So to what extent should we be seeing these various ideas about the pandemic as new and as having been created by the pandemic circumstances, and to what extent do we have to see them as part of a longer history of various ideas?
Yeah, I think that's a great question. And I think, from my perspective, at least, in many cases, the crisis really just opens up kind of a window into the way that things are already working. I mean, of course this is, something, unique and dramatic and all of that, but I don't think it causes governments and people to act in a dramatically different way than it is already somehow there, right? So we have our kind of impulses, like my point earlier about using the state capacity that states already have, right? So, Germany knows that they have their healthcare system to rely on. It's going to kind of use what it knows, right? And Kazakhstan likewise is going to use what it knows. And so in that way, I think it just reveals in clearer perspective how governments and societies are probably already working. So in that sense, it's really, it's interesting as a social scientist to kind of see how, very rarely do we see something that the whole entire world is experiencing at the same time, right? And it gives us a really important opportunity to compare across cases. Yeah, but from my perspective, I don't think that it's creating something entirely new. Because even if, looking at like the US case, right? What does COVID mobilize? It mobilizes partisanship, right? Most everything is filtered through lenses of partisanship. And, probably, in all sorts of other cases as well. In the Russian case, we've followed the Russian case really closely as well. It mobilized a really sort of micromanaging state, which is actually kind of funny in some ways, because you just see the level of micromanagement and just minutia that the government chooses to spend its time on. And I think that is just, again, the state is acting in the way that the state knows how to act, or that the state is habituated to already acting. And is this effective? Well, in some ways, maybe, and in some ways, maybe not. And in some ways, maybe sometimes the government decisions are kind of an accident if they're effective, because they're kind of just doing the things that they were already, that just come natural to them anyways.
Okay, thank you. Marilyn, did you have a question?
Yes, it's occurred to me, and as the discussion goes on, it's becoming more of an interesting question to me, and that is, you were talking about access to information through television and social media, et cetera, or whatever, through the different sources, official and unofficial. But what has struck me in my short number of years here in Kazakhstan is how much people here seem to rely on information from Moscow. And of course, this is a result of the heritage. And I was wondering if there would be a way, well, first of all, if you think it's important, and if you do think it's important, to integrate somehow into your questionnaire how much of their information is coming from their local Kazakh information sources, and how much is somehow generated in Russia and they look to, I don't want to say Mother Russia, but you know what I mean, like to the former dominant power of Moscow. Because I see it in many, many ways. You know, just people ask me like, what's the value of that? They'll ask me, how much is that in rubles? Or many other ways I notice that people still tend to think of Moscow as the source of all information.
Yeah, that's also an important question. You know, not only for people but for governments in terms of kind of the diffusion of ideas and the diffusion of policies, right? Because the government also looks to surrounding governments to see what types of policies are being adopted. So I think that is important. But what we know so far from our interviews is that people really are looking at sources of news in Kazakhstan. I mean, certainly we haven't asked so much about what channels people are watching on TV, because of course there's Russian TV and there's local TV. But when we ask them about the websites that they're going to, they're all Kazakhstani websites. So we don't see people, you know, citing Russian websites as some of their, or even things like Sputnik, we don't see them saying, well, yeah, I mostly get my news from Sputnik, which is, you know, again, Russian, even though it has a kind of a Kazakhstani branch. So we haven't picked up on that yet, though I think there's probably other more subtle ways that information diffusion kind of transfers. So I do agree that there is a powerful sort of a powerful pull, and part of it is linguistic. And so, one of the things that Akjol mentioned that I didn't get to is just the linguistic difference between access to information. And I think that some of that gets, some of your question too, Marilyn, gets teased out if we look at different coverage of the pandemic in Kazakh versus Russian, right? Because Kazakh language media is obviously not coming from Moscow in a way that Russian language media might be. So that's something that we haven't really gotten to, but we do recognize is important.
Okay, thank you.
Yeah, thanks.
I'm not seeing any other hands raised. So I think we may be at the end of our questions for today. So I will suggest we all thank our speaker again by giving her a virtual round of applause. And thank you again to Caress, and thank you all for coming. I'm going to stop the recording now.